collagen synthesis, folate. You won't be tested on pantothenic acid or biotin. Couldn't find too much on it, but pantothenic acid is part of, what do you think? Where would you find that in the body? It's part of CoAs. CoA. All right. So anyway, once again, you will not be tested, but it's important that you know as to how it plays a role. Incorporate it in coenzyme A. So we'll talk about B1 deficiency, B2, niacin, B6, B12, C, folate, and that's it. A few things that I'd like to introduce you to, however. B1, Wernicke-Korsakoff. B12, subacute combined degeneration. All right, terms that we'll see, terms that you need to know. All right, so now let's go on to the best way to do this is show you a picture. All right, fat malabsorption. How are we doing on time? All right, fat malabsorption. I need you to figure out physio a little bit. Carbohydrates. Where does the digestion of carbohydrates begin? Mouth. Thank you. If it's protein, stomach, and if it's fat, small intestine. Yeah. All right. Now, why the small intestine? There are two roles, or I'm sorry, there are two factors that come in to take care of the fat. Number one, bile. Excellent. Number two, good. Very good. The pancreas. Pancreas plays a role. Now, you guys have a picture of this. So we're in the small intestine. You have release of bile. And how about that? How convenient that they're both in a duct coming into the second duodenum. And the bile does what? What does the bile do to the fat? Nice. It emulsifies. What does that mean? That's just a term for... Right. Okay, so what you're going to do is pancreatic lipase, right? That's the enzyme from the pancreas that's going to digest the fat. But in order to digest the fat, it has to attach to the fat. How are you going to attach to the fat? Remember hydrophilic and hydrophobic? Whose fat's hydrophobic? It's afraid of the water. All right? But pancreatic lipase is a hydrophilic enzyme. If you have a hydrophilic enzyme with a hydrophobic component, how in the world are they going to come together? Who is going to create that bridge? Bile. Good old bile. Bile is an emulsifier. What does that mean? It's going to cause the fat, which is hydrophobic, to mask itself as being a hydrophilic component. If it's a hydrophilic component, then who is going to degrade it? Our good old friend, pancreatic lipase. Pancreatic lipase comes in, and so what kind of fat are we talking about? Fat, triglycerides. What are they? 3 fatty acids and a glycerol backbone. Okay. All right, so now what are we going to do? Let's take a look at a picture on the far left and follow it down. We have bile salts. They're going to emulsify it. They cover up the fat, make it hydrophilic. Pancreatic lipase comes in, degrades it. Now it can, because now they're both hydrophilic. They're best of friends. But oh my God, is he a backstabber? Kills off the kills off the triglycerides. You have 3 fatty acids, and then where is this going to be shipped, or where is it going to be? Yeah, stored initially in chylomicrons. And this is what I'd like you to take a look at. So here is the chylomicron. All right, and so then what ends up happening is that as it gets absorbed into the intestinal cell, it's going to travel into the lymphatic. So take a look at these. These are lymph nodes. Where's your lymphatics? And they're filled with chylomicrons, and all of these are going to travel up to where? Thoracic duct. Thoracic duct is going to empty into where? Yeah, the veins, and into the heart, and then down into the liver. Remember? You got to put all this stuff together, people. All right. So the reason that you can even see these lymphatics is because these are completely filled with chylomicrons, and guess what color chylomicrons is? White for the most part, right? It's all fat traveling through your thoracic duct. Here, electron microscopy. You can see your chylomicrons. This is just a river of chylomicrons. This particular patient or individual just came off of a steak dinner. They enjoyed themselves that evening. All right. So now that we have the fat, why do I even bring this up? Because we're talking about fat. What are we talking about? We're talking about fat soluble vitamins. All right, so if this is how physiology takes place, then let's talk about some of the path, all the different conditions in which you would have fat malabsorption syndromes. So, logically speaking, you're going to start with pancreatic problems, because you need pancreatic lipase. So you can have pancreatitis from possibly alcohol. You can have pancreatic stones. All those cause absolute obstruction or destruction of your lipase, so you don't have pancreatic lipase. What about bile, right? Cholelithiasis, right? Gallstones, so you can have obstruction there. What about an elderly patient who's been requesting because he's so compacted and he needs something to relieve himself? So you're going to give him chronic laxative, but be careful. All right. If you have too much of that, you end up having fat malabsorption. So let's take a look at these. Pancreatic, right? Cystic fibrosis, remember, clogs up your ducts, so you can't get rid of your or you can't release your lipase. Biliary tract manifestations, cholelithiasis or cholestasis, chronic mineral, impaired enterocytes. So now in the lumen itself, you have something such as celiac disease. You hear about this quite a bit. This has been going on in Europe for the longest time. Gluten sensitivity. You hear about gluten sensitivity, gluten-free diet. You see that in bread, things of that nature. But what does that mean? If you take in the gluten in a person who has gluten insensitivity or celiac disease, you're going to kill off the enterocyte. If you don't have the enterocyte, you can't absorb the fat. If you can't absorb the fat, you're going to have a host of issues, aren't you? That's celiac. Failure of packaging. All right, you need some of that beta-lipoprotein so that you can make your chylomicron. But what if you suffer from a condition that you can't? A. What does A mean? A. Without who? Beta-lipoprotein. So you can't package the chylomicron. So loss of mucosal surface, short bowel syndrome, bariatric surgery. That's self-explanatory. Whipple's disease. There inside your lamina propria, your macrophages are stuffed. All right, they're stuffed. So you have a problem with, in the lamina propria, you have difficulty absorbing the fat. Lymphatics, lymphoma. So anyway, point being is you see all these conditions in which you could have fat malabsorption. This is for your reference. It's a nice little slide. This is not in your handout. This is on the G drive. Once again, I added stuff. All right, I added stuff. For your reference as well. It just makes it easier. Oh, let's talk about vitamin A. 3 different forms. These are collectively known as carotenoids. You guys with me? Wake up, wake up, wake up. Carotenoids. We have retinol. Let's just do this now. Oh, retinol. Transport. Okay. Transport. It's a transport form of vitamin A. Retinal. Visual. Okay. So if it's going to be night blindness, what type of receptors are we going to talk about with retinal? Rods. Rods. So we'll see that. Retinoic acid. And then lastly, vitamin A plays a role in epithelium. And we'll see as to why. Talked about squamous metaplasia, so we'll see that. All right. Preformed. Preformed. Take it from meats. It's already been formed for you. This is a more powerful form. A more potent form. Preformed is already in the meats. Proform is what you get from your vegetables. All right. So when you take a history from your patient, you talk about their diet. Find out what's going on. Are they vegetarians? Are they hardcore vegans? Okay. Because they could possibly be deficient in certain vitamins. So these are all fat soluble. They have to be absorbed through the fat mechanism, right? All that stuff that we talked about earlier, chylomicrons and stuff like that. So they end up, the retinol. Retinol is a transport form taken up by intestinal cell, travels through your circulation, and where is it going to be stored? In your liver, okay, as retinal esters. As retinal esters. Then from here, it's going to bind to your RBP, retinol binding proteins, and then circulate, once again in the form of retinol, to all of your different parts of the body. So if it's going to your eye, what type of vitamin A is that going to be? Is that going to be retinol or retinal? Retinal, yeah. Retinal. All right, and then if it's going to travel through your skin, what kind of retinol is that going to be? Yes, I like answers, especially when they're correct. All right, so talk about preform. This is all in words. I do this quite a bit. You have the illustration, the schematic form, and then you also have in words what we're talking about. Fruits and vegetables, less potent, small intestine. Okay, retinol, right? Transported, how, in what form? Retinol. Taken up by the liver. That's more, you will not be responsible for ApoE, but you need to know that. Liver, stored as what type? Retinal esters, particularly ETO, was trying to find a picture of Ito, I just could not. And then I got that guy from the Olympics mixed up. I thought his name was Ito, but it really wasn't. Something else. So anyway, that was Ito. And then liver synthesis of RBP. And then anyway, point being is you have to know what RBP is. All right. I just have more information up there for your reference. RBP is produced by your, just like everything else, just like bile is or bilirubin is bound to your albumin, right? Here in this particular case, you'll have retinol, which is bound to RBP, okay? All right, so let's go into vitamin A functioning, and here, so we talked about retinol, transport form, comes into your RPE. What's RPE? Retinal pigment epithelium. Is this the non-sensory and sensory part of your retina? Non-sensory. The sensory is obviously what? Cones and rods. So this is non-sensory. Is your choroidal vessels. They come in, and then you have, so what type of retinoic acid, or I'm sorry, what type of vitamin A? We said retinal. And then, actually, I have a, oh, no, I guess not here. Okay. It's 11-cis retinal, but all that I will hold you responsible for is knowing that it's retinal. And then this will bind with opsin. So what are we going to form? Remember, we're going to synthesize rhodopsin. Because eventually, if you have deficiency of this, what are we going to result in? What type of blindness? Night blindness, exactly. So if you don't have the rods, you can't see in the dark, and hence the problem. And this is just for your reference. This is deeper. Here's a vitreous body. Here's your retina, and this is the RPE that I was. This is what this is in reference to. This is a retinal pigment epithelium. Just in case you've forgotten as to what it might be because you love the eye in second semester so much. All right, now, epithelial mechanism. This is important. Well, I don't think there was anything that I've talked about that really isn't, but pay attention. The eye was retinal. The skin is retinoic acid. It is a fat-soluble vitamin. If it's a fat-soluble vitamin, the type of characteristic that it possesses is that it's going to have an effect on your DNA in the cell. That is so key, especially for epithelium. What type of epithelium do you have in your respiratory system? Pseudo-stratified, columnar, ciliated epithelium. What does columnar mean? What does columnar mean? What does that enable you to do if you have columnar cells? You're going to produce mucus, right? If you're going to produce mucus, you're going to actually protect yourself. Okay, what happens if you can't produce that mucus? Are you prone to infection? What do you think? Yeah, you're prone to infection. Do you see where I'm headed? If not, you will in a second. Retinoic acid, all right? Retinoic acid. What is that? What did we say? We said that it has an effect on your DNA. Remember all this stuff? That picture on your far upper left is retinoic acid response element, part of your promoter, upstream DNA. 5' or 3'? If you don't remember, look it up, but not for me, for your own sake. Got to know that. You have to know what upstream means. It's a promoter region. Retinoic acid response element, part of DNA. Why can this even reach your DNA? Because it's a fat-soluble vitamin. All right? So think about what you're dealing with. All right, so now we're done in the DNA. And if you can make certain changes, what kind of changes do you think retinoic acid is going to make? What kind of cell do you think it's going to instruct it to become? What do you think? Columnar cells. It's going to instruct the cell to become a columnar cell. Differentiation. Now, if you don't have the vitamin A, by default, what type of cell are you going to turn into? A squamous cell. Are you guys with me? All right, so the vitamin A, as in the form of retinoic acid, is going to bind to your DNA in the promoter region, and it's going to instruct the DNA to turn it into a columnar cell. If it doesn't do that, by default, it's going to turn into a squamous cell. So all the cells it's in the respiratory system that should be columnar, producing the mucus, that should be columnar, should be producing the mucus, and it turns into a squamous cell. It's known as keratinization. If it becomes keratinized in your respiratory system, and if you don't have the mucus, are you going to protect yourself any longer? No, you can't. You become prone to infections. become prone to infection. But that's not the only place. You have columnar cells in a bunch of places. What about the skin? Yes. What about the intestine? Yes.